I think that we have to understand the evolution of cancer with time and what happens when we treat those cells. And I think if you look at, say, endometrial cancer, we don't fully understand what the escape mechanisms are for those cancer cells. And in order to do that, we need to learn more about those and how different factors play in. I haven't really said a lot about the host factors. Historically, our data has been based on largely white patients and how the body kind of impacts the tumor and microenvironment, and perhaps how the microbiome impacts tumor and response. Because it's not that the tumor sits there in isolation from the rest of the body, cells are going in and out of there. And certainly there's a lot of data around how the gut and the bacteria within the gut can change what the microbiome, that the tumor microenvironment might look like within the tumor. And in the case of gynecologic cancers, even, vaginal flora. When we think about the tumor microenvironment in the context of sequencing of therapies, and by therapies, I'm kind of referring to surgery, radiotherapy, as well as systemic treatment. We have to learn more about what the impact of each of our treatments truly is. We have to understand that when we give treatments, whether we are in essence poisoning the well by giving that treatment that then may negatively impact subsequent treatments, understanding whether giving chemotherapy, for example, which can produce a lot of changes in the tumor microenvironment, both in response and also in resistance and remodeling. Does that help, or does that hinder your newer targeted agents when they become available in the clinic? I think we have to be smarter about what we do, and we need to incorporate correlative studies into all of the work we do so that we can really understand what we're doing when we give therapies, and that will inform the order that we should be giving treatment in, and hopefully get to a truly personalized approach to treatment.